Hi everyone, welcome today to our session. My name is Lauren Pongin. I am the National Director of the Diverse Elders Coalition. Founded in 2010, the Diverse Elders Coalition advocates for policies and programs that improve aging in our communities as racially and ethnically diverse people, American Indians and Alaska Natives, and lesbian, gay, bisexual, and/or transgender people. Thank you for attending the release of our report, which was co-authored by the Diverse Elders Coalition and our member organizations, as well as the National Alliance for Caregiving. This report's titled Family Caregiving in Diverse Communities, Addressing the Needs of Diverse Family Caregivers for Older Adults. Before we start, I just wanted to acknowledge and thank the staff of the Diverse Elders Coalition, Ocean and Nina, for their work on this project, as well as our member organizations, which are the National Asian Pacific Center on Aging, the National Caucus and Center on Black Aging, the National Hispanic Council on Aging, the National Indian Council on Aging, SAGE, and the Southeast Asia Resource Action Center. Together, our members put on webinars for caregivers from their communities, and over 300 attended. And we're really excited about sharing this report, not only because it captures some of the quantitative data about our communities, but it also includes 4 stories from community members and their experiences of caregiving through the pandemic. At today's briefing, we'll hear about current policy landscapes from policy experts, hear remarks from Chairman Bobby Scott, and we'll unpack findings from our original research and their implications for equitably implementing the Raise Family Caregivers Act. We're also really excited to hear from from 2 community members who are a caregiver and a care recipient about their real-life challenges and the joys that caregiving brings to their lives. Now I'll pass it over to Mike Whitkey at the National Alliance for Caregiving, our partners and co-authors for this report.
Thank you, Lauren. I'll just do a quick tech check and make sure you can hear me okay.
Yep, we can hear you.
Great, thank you. And thanks again, Lauren. It's been an honor to partner on this work, and we're extremely grateful for the work you and DEC members do. DEC's mission and the work of DEC member organizations is critically important to ensuring older adults from all communities in our country have a voice in policy and beyond. And we at the National Alliance for Caregiving focus on making life better for all family caregivers across the lifespan by doing work in research, advocacy, and innovation. Over the course of the past year especially, we've been focused on understanding the lived experiences of family caregivers, often referred to as unpaid or informal caregivers from diverse communities. We have partnered with the DEC not only on this report we're about to cover, but we also worked with them on a secondary analysis the National Alliance for Caregiving led that highlighted data from a nationally representative survey of caregivers we conducted in 2019 in partnership with AARP's Public Policy Institute. That report was just released today as well. You'll hear more later about how that report and this work intersect. I'd like to acknowledge those on the NAC team who have made all of this work possible and helped get it out to you today. So a big shout out to Dr. Mozami Bose, Lauren Tokarowicz, Bernadette Wright, Brian Lindberg, and Autumn Campbell. A few comments about the current policy landscape for you to consider as we're sharing our findings with you throughout the presentation. First, in the short term, we need to ensure that the Senate includes paid leave for family caregivers in the Build Back Better legislation. Paid leave has been on the chopping block and it narrowly made it through the House. Now it's time to ensure that paid family and medical leave becomes law. The COVID-19 pandemic has had a devastating impact, not only on the health, but also economically on diverse communities and families, especially on the millions of families providing care for a loved one with a serious medical condition, such as Alzheimer's disease or a disability. According to the Bipartisan Policy Center, 16% of Latinos and 13% of Black Americans reported leaving the workforce due to family caregiving responsibilities for an adult loved one during the pandemic. A national paid family and medical leave policy would help family caregivers stay in the workforce as long as possible as they navigate care for their loved ones. There's nothing more immediately we can do for caregivers of diverse populations than pass paid family and medical leave. Although the issues caregivers face become more challenging as a result of the pandemic, many caregivers faced a state of crisis before the pandemic, and that will be the reality for millions of people even after. Which leads me to the work that needs to be done beyond Build Back Better. Over the course of the next year, a federally led effort under the U.S. Department of Health and Human Services Administration for Community Living is taking place to develop a national family caregiving strategy. This is the result of the passage of a bill in 2018 called the Recognize, Assist, Include, Support, and Engage, or RAISE Family Caregivers Act. As a part of that effort, a set of recommendations were just sent to members of Congress this fall outlining what this national strategy will encompass. We have focused the policy recommendations of this report to align with the policy areas that the national strategy encompasses, and they are as follows. Priority area number 1, increased awareness of LGBTQ+ caregivers, tribal caregivers, as well as caregivers from other diverse communities, including education, defining who is eligible for services. Priority area 2, increased emphasis on integrating caregivers considered family of choice, immigrant caregivers, limited English proficient caregivers, caregivers from the same tribe, and long distance caregivers into processes and systems from which they have traditionally been excluded. Priority area number 3, increased access to services and supports to assist family caregivers by including investing into more resources to overcome language and cultural barriers and prioritize traditional translated resources, services, and information. Priority area number 4, increased financial and workplace protections for caregivers with a specific focus on preparing to care for the future finances, and financial education. And priority area number 5, better and more consistent research and data collection facilitated through partnerships with CBOs who have established community trust with the aim of increased participation in research studies like caregiving surveys or focus groups. You can find these recommendations in the report and in the companion one-pager that we will be sure is sent out. And we look forward to partnering with many of you listening to ensure those recommendations become reality. Again, we're excited to share this work, and thank you for joining this event.
Thank you, Mike. And I did see a question from the audience about slides, and no one has used slides so far. So you're not missing anything. It's just what we're sharing in the chat. There are a couple links to resources and just what we're sharing verbally. Next, it's my pleasure to introduce Ronnie Snyder, Vice President for Program at the John A. Hartford Foundation. As Erin Tax will discuss coming up, the John A. Hartford Foundation has supported our research since 2017 and has recognized the unique contributions of the Diverse Elders Coalition in the sphere of caregiving and caregiving advocacy. So looking forward to hearing from you, Ronnie.
Thank you, Lauren. And thank you, Mike, also. So Lauren introduced me. I'm Ronnie Snyder. I'm the Vice President for Program at the John A. Hartford Foundation. We are a proud funder of the Diverse Elders Coalition and the National Alliance for Caregiving as well, and a sponsor of today's briefing in family caregiving for diverse communities. And on behalf of the foundation, I really want to thank you for taking the time to join this really, we think, important event. We, the foundation, are a national, nonpartisan philanthropy. We're based in New York City, although we fund across the country, and our mission is to improve the care of older adults. So we do that by working in 3 primary areas: creating age-friendly health systems, supporting family caregivers, that's what we're here to talk about today, and improving serious illness and end of life. And through our various grants and programs, we really strive to make care more equitable, more age-friendly, and ultimately aligned with what matters to all of us. So what matters most as we get older is often family and friends, those in our lives, and especially those who take care of us and who we take care of. So there are currently about 53 million people in this country who provide assistance to an older adult or someone with a disability or a child with special needs. And I would wager that many of you listening right now either are or maybe know a family caregiver. Caregivers really are the backbone of care for this nation, and they need more support. To be effective, that support has to be tailored to the diverse needs of caregivers across race, ethnicity, sexual orientation. And we really view this as a mandate, not an option. We know that racial and ethnic minority populations of older adults in the US are going to more than double between now and 2040, at which time they'll make up more than a third of all older adults. And we know, unfortunately, all too well from the pandemic that structural inequities and disparities in health and social well-being affect people of color at, I can't even use the word unacceptable rates, it's unconscionable rates. Culturally and linguistically appropriate services are often what makes a difference in the lives of caregivers and care recipients in Black and Brown and LGBT communities. So today, you're going to hear findings and recommendations from the research of the Diverse Elders Coalition and the National Alliance for Caregiving on how to ensure that we can deliver the right kinds of support to diverse caregivers. So we now have a platform on which to make all of this a reality. And Lauren mentioned it, and Mike mentioned it. It's the Recognize, Assist, Include, Support, and Engage, or the RAISE Family Caregivers Act. You're going to hear a little bit more about it. Thank you, Mike, for filling in some of the specifics. And you'll hear more about its congressionally mandated advisory council, which has produced the initial report this fall. And the first ever national strategy, it'll be based on that report, but the strategy to implement those recommendations by federal and state and local, as well as private stakeholders, will be issued next year. So as mentioned, the Diverse Elders Coalition and the National Alliance for Caregiving have been really deeply engaged already in the RAISE Act work, and their new research and recommendations presented today, as Mike showed you, are going to help make our national strategy more equitable and more inclusive. So I really just want to thank today's presenters from outstanding organizations for what I already know is going to be an engaging and informative session. I want to thank Congressman Bobby Scott for his leadership on and attention to these really critical issues. And I want to express my personal gratitude to the Conways, the family caregivers who are going to be sharing their story today, and also to other caregivers who are no doubt in our audience. Your voice matters. We at the Johnny Hartford Foundation are committed to continuing to raise your voices and invite you to stay in touch with us. Together, we would really like to raise up family caregivers and meet their needs. So thank you once again.
Thank you so much, Ronnie, for those words and just for reminding us that the caregivers are at the heart of our work. It's my pleasure next to introduce Quinn Din, Executive Director of the Southeast Asia Resource Action Center, one of our 6 coalition member organizations, who will be introducing our special guest. So welcome, Quinn.
Great. Thank you so much, Lauren. We are so honored to have with us today a great advocate for the older adults and family caregivers in his district, for his state of Virginia, and for our nation, Chairman Bobby Scott. As chairman of the House Education and Labor Committee, Bobby Scott has been a true leader in supporting family caregivers, particularly those in the greatest economic and social need. Through his efforts to reauthorize the Older Americans Act, increases were provided for the National Family Caregiver Support Program, family assessments were improved, the RAISE Family Caregiver Advisory Panel was extended, and many other programs were reauthorized supporting caregivers. During the COVID-19 pandemic, Chairman Scott included hundreds of millions of additional dollars for the Older Americans Act Caregiver Support Program, and there's $150 million more included in the House-passed Build Back Better Act. There's also $75 million more for a new research demonstration and evaluation center for the Aging Network, which will help to ensure that we examine the Older American Act's programs to ensure that services are appropriately targeted to older adults in the greatest need, including historically underserved populations. Chairman Bobby Scott is the driving force behind all these investments. He has also supported the Build Back Better provisions, which would provide for the first time 4 weeks of family and medical paid leave, which will help so many who face serious illness. There's so much more to be said about Chairman Scott, but let me end with the fact that he and his staff are committed to ensuring that the RAISE Family Caregiver Advisory Panel, its recommendations and implementation strategies address the growing challenges of our family caregivers. Family caregiving is an issue that is so near and dear to CREC in our communities. And as representatives of the largest community of refugees ever to be resettled in America, from Cambodia, Laos, and Vietnam, as survivors of war, genocide, and generational poverty, being part of the DEC's family caregiving research allowed our own community members the opportunity to heal for the first time. Caregivers shared their challenges, ranging from cultural tasks like translating, navigating generation and cultural expectations, to strains on their health, both physical and mental, and financial burden, especially as our communities experience poverty at higher rates compared to the national average. When we shared these data with our community, caregivers shed tears hearing their experiences through our report, feeling affirmed, feeling like for the first time, they are not alone. And as Saneri shares in our report, caregiving should not be an individual decision alone. And from my own personal experience as someone who has recently lost my father, I and my family know that caregiving is a responsibility, a joy, and an honor that should be one shared by the community and supported by institutions and policies that allow our families to love, heal, and thrive. Chairman Scott, thank you so much for your Herculean efforts to make this a reality for our family caregivers and for joining us today. Chairman Scott, welcome, and I yield the floor to you, sir.
Well, thank you, Quinn, for your very kind introduction. And thank you to the Diverse Elders Coalition and the National Alliance for Caregiving for inviting me to speak and for the work you do to support family caregivers and older Americans. Home and community-based care is essential in safeguarding the physical and emotional health of millions of seniors and enables them to live in their homes, not in facilities. Even before the pandemic, we know that the cost and limited availability of home health aides required many family members and friends to take on the caregiving role. Furthermore, as the newly released report highlights, LGBTQ indigenous individuals and people of color face steep barriers in accessing care that is culturally appropriate, forcing many of their family members to serve as primary caregivers. An unpaid and oftentimes invisible role, family caregivers can experience dangerous and damaging financial and health consequences. And as those of you joining today know so well, the impact does not hit all families equally. Black and LGBTQ caregivers take on more debt, use personal savings to cover the cost of care, and are forced to stop saving for retirement more often than other caregivers. Additionally, the time spent caregiving can push caregivers into isolation. Unfortunately, Black and Hispanic caregivers experience higher rates of depression and anxiety compared to other caregivers because they lack access to support services. COVID-19 pandemic has drastically worsened these challenges. The pandemic overwhelmed our healthcare system and closed adult daycare centers, requiring family caregivers to provide increased care at home. This pushed more caregivers out of work and into isolation, leading to even greater financial and mental health care challenges. New research being released today is critical to better understanding the challenges that diverse family caregivers face and how community groups and lawmakers can better support unpaid caregivers and seniors. As chair of the Committee on Education and Labor, I've advanced several proposals to help caregivers deliver critical support without having to sacrifice their financial, mental, or physical health. The RAISE Act in 2018, the Recognize, Assist, Include, Support, and Engage, or RAISE Act, Family Caregivers Act, was signed into law to establish a national family caregiving agenda and improve coordination across government programs that assist caregivers and care recipients. In September of this year, the Advisory Council tasked with implementation released its preliminary report to Congress detailing its plan to meet 5 goals. First, expand outreach and education for family caregivers. Second, engage caregivers as partners in providing healthcare and long-term services and supports for their loved ones. Third, improve access to services and supports, such as respite care, counseling, and transportation assistance. Fourth, ensure that financial and workplace security for family givers. And finally, generate research data and evidence-based practices to develop policies and programs that meaningfully help caregivers. I look forward to seeing the Council's National Caregiving Strategy in 2022, which should focus on our efforts to help family caregivers. The Older Americans Act in March of 2020, under the leadership of the Civil Rights and Human Resources Subcommittee Chair Suzanne Bonamici of Oregon, we led a bipartisan reauthorization of the Older Americans Act, which provided record levels of support for OAA funding and focused on supporting family caregivers and addressing social isolation. Over the last year, we reinforced this reauthorization through historic relief packages that combined dedicated more than $2.5 billion in additional funding for OAA programs. This funding has been critical to ensuring that nutrition assistance programs, as well as respite care, transportation, and other supportive services can continue serving older adults throughout the pandemic. For example, in March 2021, Congress passed President Biden's American Rescue Plan, which invested $1.4 billion in OAA programs, including nutrition programs and supportive services. And while these packages provided urgent relief during the pandemic, the Build Back Better Act is an opportunity to secure additional investments that are badly needed. House Democrats' proposal included an additional $1 billion for many proven programs under the Older Americans Act that will increase funding for the National Family Caregiving Support Program to provide assistance, counseling, and respite for family caregivers, will increase funding for aging services for Native American older adults, will increase technical assistance and training on culturally appropriate care. It'll provide new targeted funding for behavioral health services for unpaid caregivers, and it'll fund a National Technical Assistance Center to provide support to paid and unpaid family caregivers. The Build Back Better Act also improves and expands Medicaid coverage for home health care services for seniors and people with disabilities. This will help ease the care burden for many families. These investments will not only be historic, but they will also be sensible and necessary to protect the lives and livelihoods of our nation's family caregivers and seniors. But without your support and research, our legislative progress would not have been possible. So I want to thank you again for the work that you do to build a more equitable and inclusive healthcare system for family caregivers and older Americans, and look forward to continuing working together. Thank you.
Thank you so much, Chairman Scott, for those remarks, and also just as Quinn mentioned, for your work championing diverse communities and caregivers through the Older Americans Act and the Build Back Better Act.
Thank you.
And what would all of these policies, best practices, et cetera, be without the caregivers themselves? And I just want to bring it back to why we do this work. So it's my pleasure to introduce another staff person from one of the DEC's member organizations, the National Caucus and Center on Black Aging, Keisha Lewis, who'll be introducing a family caregiver and family care recipient from our community. So welcome, Keisha.
Hi, my name is Keisha Lewis. I'm an occupational therapist and health programs consultant located in the Washington, D.C. metro area. I'm here today representing the National Caucus and Center on Black Aging Incorporated, also known as NCBA. NCBA is a founding member of the Diverse Elders Coalition, and it was founded in 1970. The National Caucus and Center on Black Aging Incorporated is a national 501c3 nonprofit organization headquartered in Washington, D.C. NCBA is the only national aging organization who meets and addresses the social and economic challenges of low-income African-American and Black older adults, their families, caregivers, and those over age 60. NCBA constituents also include older adults who may be Afro-Cuban, Afro-Caribbean, Afro-Brazilian, Afro-Haitian, Afro-Latinx, Asian American, Pacific Islander, Southeast Asian Americans, lesbian, gay, bisexual, or transgender, and older adults living with disabilities. NCBA's cornerstone programs include safe and affordable housing, job training and employment opportunities, health and wellness programming that promotes vitality at a mature age, and gerontological research. The organization has proven the capacity to offer authentic, person-centered approaches to addressing the quality of life and the needs of low-income African-American older adults. It is my pleasure today to introduce to you two amazing people, an amazing couple, Mr. Sharon and Hampton Conway. They have been married for 52 years, and Sharon has provided care to Mr. Hampton for the past 16 years. Ms. Conway has much to offer regarding the role of being a caregiver, one in which she has served for the last 35 years. She has cared for family members ranging from ages 3 to 98. Mrs. Conway retired after 33 years as a science teacher and administrator in the Prince George's County public school system. And Mr. Hampton Conway, he experienced a left upper extremity amputation 16 years ago. And in August of 2020, he had a knee replacement. And in early September of this year, he also had a right shoulder replacement, leaving him the inability to use either arm. Again, Sharon came in to provide care. Hampton served in the armed forces for 3 years, and he retired after 37 years working for the federal government in Fort Meade, Maryland. Mr. and Mrs. Conway have offered great insight, helping me to understand more about the role of a caregiver as well as a care recipient. Their home base is Beltsville, Maryland. They are considered perennial snowbirds, and for the last 2 years, they have lived full-time in a 42-foot motorhome. They have visited all 50 states, and they are currently in Conway, South Carolina for the month of December before moving down to Polk City, Florida, until they return home in May. I like to say that they are living their best retired life. So please join me in welcoming Mr. and Mrs. Sharon and Hampton Conway.
Wow. Mr. Lewis, thank you. Wow.
Thank you.
Wow.
We thank you for this opportunity, Keisha. And we find ourselves being blessed by this journey we're on that officially started, I guess, 16 years ago. But it really started right after we got married, because I was the one who was sick all the time. I had so many operations. I can't even tell you how many I had. And so Hamp was my caregiver. And I always tell him that he was putting money in the bank and he's drawing interest right now. But we're in a place that most caregivers don't find themselves, in that my care recipient is able to give me feedback. He's lucid, well, most of the time. And he tells me.
That's what you call it, feedback.
Yes, my feedback, yes. And he talked to me. He can love on me, and I appreciate that. And he's able to help a lot. But I was able to get a glimpse of what it's like to have a care recipient that you totally care for. And let him tell you about that. What happened to us in September.
Oh, in September. Oh my gosh. You know, like Ms. Lewis said, we've been taking care. You know, when we got married, we said for rich or poor, in sickness and in health. So all that stuff that comes with it. Okay, we were trying to have children, and we found out that we had to have a whole lot of surgeries because parts were in the wrong places, and some of them weren't even open. So we had a whole lot of surgeries. And unbeknownst to me, I didn't realize, I never thought about it. It was automatic. I'm going to take care of my baby to get her back to where she can take care of herself. And that was, there was no big deal about that to me. Okay. So I was cooking, bottle washing, doing all that kind of stuff. Going to work, running home from lunchtime to make sure she was okay and go back to work. Things like that. It was automatic. And then in September, boy, I really had a setback. I don't have a left arm. I was left-handed. In August of 2005, a tractor trailer ran a red light as we were riding our motorcycles. We had just come back from a trip across country, riding our motorcycles, Honda Gold Wings. Sharon had a trike, and mine was two-wheeler. We rode from Maryland to Maryland to California, to Maine, back to Maryland, 37 days, not one incident. 4 miles from our house, a tractor trailer runs a red light and hits me. Sharon she rode in front of me. She was able to swerve and miss it. But I had nowhere to go. And I tried to turn to get away from it, but it ended up running up my left arm. And when it came to stop, the right front tire was up my arm and up against my helmet. Next thing you know, I'm on a helicopter being taken to Washington, DC. And after a few conversations with doctors. And I talked with Sharon and she told me, I'm going to love you no matter what. I said, well, shoot, let's get over with this thing then. And I asked the doctors when were they going to amputate my arm, because I could see it wasn't working. They had me prepped for surgeries. I think I had 11 where they were trying to reconnect tendons and muscles and veins and all that, nerve endings. It wasn't working. My arm I couldn't control it, and it was getting black. I mean, blacker than I am. It was really getting black. So one morning, I just asked the doctors, when were they going to amputate my arm so I could get on with my life? And they came in and they acted like I took a weight off of them. They were so relieved. I don't know if they were coming to tell me that they thought we ought to consider that, but I took it away from them. I just said, look, let's do this. Let's take off the arm and let me get on with my life. So they did. And I've had 2 prosthetics. I hate them. They slow me down more than they help me, okay? So I'm able to do things. It takes me longer to get dressed, but it took me even longer to get dressed when I had those prosthetic arms on, okay? So I don't have an arm. I'm armless. I don't have a left arm, okay? And I'm doing fine. The only thing that I think I really miss is I can't fish like I used to, but I can still cook. I do cook.
We'll have to do it in September.
Oh, in September, that was the original question.
Yes,
You're right.
yes,
Okay.
That's okay.
In September, I had to have, in August of last year, I had my left knee replaced. In September of this year, I had to have my right shoulder replaced. And for at least 4 weeks.
6 weeks.
6 weeks.
Yes.
Okay. My right arm was secured to my side and resting in my stomach area. I couldn't move it. I could not do anything for myself. I couldn't feed myself. I couldn't brush my own teeth. I couldn't wipe my own behind. Okay. My beloved here took care of all of that for me. I was a 263-pound baby. But we got through it. Thanks be to God, we got through it. And everything is well.
It showed me in that time period where he was totally unable to help himself. It gave me a deeper respect for a lot of caregivers who find themselves in that, and their care recipient does not get better. Mm-hmm. And they don't get the feedback socially. They don't get a respite because it's very isolating. During that time, we had 2 of his brothers who came in and took care of him. They fed him, and and I told people, please call him. We didn't have any visitors because of COVID, but I said, please call him to keep him on the phone because he was trying to do too much. And I knew if he was talking on the phone, he couldn't do anything else. And I bought a chair for him. I don't think they can see your chair, but it was a chair that made him go all the way back. And what I would do is I would put him in the chair, push the button so it would lean him all the way back so he couldn't get out. And because he kept getting into stuff. And so
I just wanted to help y'all.
I know, baby. I know, honey.
I'm not a guy who has to be taken care of. I'm a guy that will take care of you. And I wanted to make the responsibility she had on me as easy as possible.
And some of that came out in frustration where he would snap at me and get angry with me. And I had to be understand his frustration with his condition. Yeah, baby, I'm talking, professionally now. That his frustration with his condition caused him to lash out at me. I'm not a baby. Stop treating me like a baby. I can do this myself. And he couldn't do it by himself. And he'd make a mess trying to do it for himself. So I know there are people who are in this situation perennially, all the time, every day, 24/7, where the person they're caring for feels guilty. And I know he felt it. I was a kept woman for 30, what's 20, what's 52 minus 16? 40, 36. Anyway, I was a kept woman. I didn't put gas in my car. I didn't open the door. And all these things that he did for me, he was not able to do anymore for me. And I know it bothered him to see me pumping my own gas. I know it bothered him seeing me taking out trash and garbage. And he felt bad. And I didn't. I was born for this. I've been a caregiver for 35 years to many family members, to my grandchildren. and to my son and our son. And so, and I told the Lord, I said, if you give me this man, I don't care how many pieces you take off of him, if I could have his head in a handbasket, I was going to be happy. And so I could go on like this for the rest of his life or mine. The only limiting factor is I'm getting older, and I feel a lot more on me physically now and my health than I did 16 years ago. 16 years ago, I was only 58 years old. I was still kicking high and squatting low. Yeah, baby, I was. Yes, I was. Yes. Anyway, so now I get that leg up and I can't get it down. So I realized that, and unfortunately, Hamp is going to need care for the rest of his life. Eventually, I'm going to need care. I was able to get long-term care insurance. He could have gotten it, but because of his pre-existing conditions, it was so expensive, we lost our house. And so we decided, because since he's a veteran, we knew push comes to shove, he could go to a VA home. But for me, I knew I needed some out, because I did not want our children to be taxed with us. And that brings on another point that you'll see in many ethnic communities, is that they exude the promise. And the promise is, please don't put me in a nursing home when I get old. You know, I want to stay home as long as possible. Now I know that people who are not all the ethnicities that Keisha was listing and everybody else was listening, they also didn't want to go to a nursing home. But historically, the nicer places that we are now seeing 50 years ago were meant just for whites who could afford them. And so we had no choice but to go to a nursing home that was dilapidated, decrepit, looked like Bedlam. And so that's what we didn't want to, our parents and grandparents didn't want to be sent to anything like that. Now, these nicer places have opened up, and we found a lot of resistance, even though our mother had long-term care insurance, and so did my dad. They were very resistant to going to an assisted living because they thought it was a nursing home. So I think there needs to be more education about what assisted living is and what it is not. Also, it would be great to be able to have more access to these facilities, either as a tax credit if you go to one to help you pay for, because some of them are very expensive, and or a long-term insurance that make those premiums more affordable, so that I'm actually able to make that deduction on my income tax. But still, we're paying over $100,000 a year for our mother to have care in my sister's home, because my sister has injured herself lifting my dad, because he lived with them too. So she has torn rotator cuffs in both shoulders. She's no longer able to lift my mother, but she's only able to afford care for her mother for 6 to 8 hours a day. So that means for 16 hours, you have an older one. My sister is going to be 70 in January. She has to do all of this with 2 busted shoulders, and it's difficult for her. And so in the meantime, the care to my mother is compromised because my sister's not able to turn her over. My sister's husband has a bad back and he can't do it. And so these problems are not unique to us, and they are even worse in some circumstances. What about the families who didn't have good jobs? We have a very good retirement, but we had a huge savings that was completely depleted caring for my grandmother, my aunt, and so it doesn't make sense that we would have to sign away our home to be able to stay in our home. And generational wealth in our family, we don't even do that anymore. So that's gone. So, but there has to be some help somewhere. But I would suggest that we have more therapy and counseling available to caregivers and care recipients who are able to receive that, because it would have helped. Thankfully, Hamp and I, we've been going to therapy all through our marriage, not because it was bad, but because our marriage was so good and we didn't want the good stuff to stop. So we've been going to couples counseling, and we were certified couples counselors ourselves. And so we could foresee some of the problems before they even became an issue in our marriage. And there's a transition that couples have to make if the wife or the husband is a caregiver. They have to go from being lovers to being caregivers. And it's a very difficult situation. I have tried to bridge it. Hamp tries to bridge it. We used to take our showers faithfully every day together, with all the benefits of that. Now we're here in the motorhome, and bless our hearts, we got both of us got in that shower. We couldn't get out. So if we're going to wash anything, we just stuck in there. But when I can't even take a shower the same time as I give him one, because once I finish washing all this goodness and mercy, I'm tired. I need a nap. And so I usually take mine in the morning and give him his at night. And so he is my 280 pounds?
263 pound baby.
Oh, he lost the weight. He lost 30 pounds. Yes, bless his heart. And so it is a lot. It takes a lot. The hardest part for me as a caregiver has been the mealtime and navigating the meals. And I know in one of the budgets or something, they were going to think about cutting Meals on Wheels. Lord have mercy, Jesus, Representative Scott, please don't let them cut the Meals on Wheels. We don't get Meals on Wheels, but because we don't really need it, but I sure wish, because I don't think he would eat it. I don't think he would eat it, would you? No, he's a country boy. He wants meat, potato, steak, fried chicken, fried pork chops. I love to cook. But some of the stuff I cook, he reluctantly eats it. Like yesterday we had barbecue neck bones. He was too through with me, but they were good, weren't they? But we need the meals to be able to be accessible. We need them to be because sometimes this is the only person that people who are housebound see. We have a neighbor, and someone comes to his house every about once or twice a week to bring him a meal, one of his relatives, and he's in there, and I don't know what condition he's in. I've called social services on him twice, and his children about through with me, but I could not sit there and see what was happening there and not say something. But so anyway, you have something else to say, baby?
No, we're good. That's it.
You good?
Yeah.
Okay.
Yeah.
All right.
It does take it does take energy, and we're fortunate because we love each other, and that helps a lot. We're fortunate also because of our retirement system. That helps us a lot. Mm-hmm. But for those who don't have that, it's going to be a hard road.
Yes, it is
a rough road.
Oh yeah, and even though my parents have long-term care insurance, it was only 3 years, and that's at the time they got it, which was probably 30 years ago. That was as long as you could get it. The one I have gives me a big pool of money, about $600,000. No, I cannot get that. So my children are watching. Don't ask for none. Anyway, but and I can tap into that, but it costs over $100,000 for care. Now, long-term care facilities are not that expensive. They are a lot less expensive. They're only about, I would say about $4,000 a month, which sounds like a lot. But if you have 24-hour care in your home, my sister is paying about $24 an hour for long-term care for our mother in her home. So that's a lot of money. And so it would really help if the long-term care was extended so that we could have more access to it. And because people are outliving their long-term care insurance. And so it would help. So what happens to them then? And so what happens to them is what's happening to my mom. She's in my sister's house. My sister her health is being compromised. Her finances are being compromised. Ours is being compromised. And so this needs to be addressed also. I think I'm done now. Yes, I'm not going to talk anymore. I could talk till tomorrow, but I'm done.
Wow, as all I have to say, Mr. and Mrs. Conway, thank you so much. I know you all have been on camera, so you haven't seen the chat, but there are over 50 or 60 messages requesting master classes in caregiving, master classes in true love, requesting a reality TV show, y'all coming to DC, running for office. So you have a fan base here, and Folks have been on Zoom so much since COVID-19 pandemic started, but people are saying that this is the best Zoom they've ever been on in their lives. So that is huge credit to you all. Thank you for seamlessly weaving together your personal story. I think Sharon, you covered Medicare premiums, long-term care, financing, all the different policy areas, just because it's your own experience in life. So thank you so much for inspiring us and making us laugh. I teared up definitely at one point, but I also laughed a lot out loud. Thank you from the bottom of our hearts for sharing that story with us.
This is therapeutic for us.
Yes,
Yes.
yes.
Yes. We can go get naked after this. Yes.
Thank
Yeah, we
you.
look forward to naked naps. That's the best. I would highly recommend it. Yeah. I better stop.
Thank you so much. I now have to give I have to give Erin Tax the impossible job of following them. So I should have probably revisited our agenda, knowing how strong storytellers the Conways are. But Erin has the job of following them, which again, we'll just give him credit right up front because it's an impossible act to follow. But it's my pleasure to next introduce Erin Tax, Director of Advocacy at SAGE, one of the DEC's member organizations. I think he'll be, oh, there you are, Erin, joining us. I know you had a couple connectivity issues, so hopefully we can hear you. And again, we won't hold it against you that it will be as impossible to be as funny and witty as the Conways and heartfelt, especially because you're sharing some report findings. But nonetheless, I'll pass it over to you and thank you for speaking with us today.
All right. Well, thanks so much, Lauren. And I hope the Conways have an amazing naked nap as I dive into the details of the caregiving report. So a huge thanks, as everyone is relating to the Conways, for sharing their story today. Also a huge thank you to Chairman Scott and his staff, including Ellie and Carrie, if you're on the call today. They've been huge champions for everyone in the Diverse Elders Coalition, and particularly LGBT older folks. And we wouldn't have gotten to where we are on the Hill without you. So huge thanks to Chairman Scott's office and to our fellow DEC partners. So with that, I'm going to tell you a little bit about SAGE, who we are and what we do, and then dive in a little bit to the report entitled Family Caregiving in Diverse Communities, Addressing the Needs of Diverse Family Caregivers for Older Adults. So first, a little bit about SAGE. We are the nation's largest and ironically oldest organization dedicated to improving the lives of LGBT older people. We were founded in New York City in 1978. We currently run the federally funded National Resource Center on LGBT Aging, which provides information to LGBT older people themselves, to aging organizations, as well as to LGBT organizations about how to better meet the needs of older folks. In addition to that, we have a training arm called Sage Care, where we've trained tens of thousands of organizations across the country on how to better serve the needs of older people. And we have about 30 affiliates across 22 states and Puerto Rico, which provides some measure of social services and supports to LGBT older people in their communities. In New York City, we have a care management team. We also run approximately a half dozen LGBT targeted senior centers and 2 buildings for LGBT older people. And then here, as Lauren mentioned at SAGE, I run our policy shop. And in a nutshell, I try to make sure that our federal aging policies are LGBT inclusive. And as we advocate for LGBT friendly policies, that they are inclusive of the needs of older people. So that's a little bit about SAGE, who we are and what we do. And with that, I'm going to dive into a little bit of background on the report that we're releasing, where it came from, how we put it together, and what it recommends. So the report again is entitled Family Caregiving in Diverse Communities, Addressing the Needs of Diverse Family Caregivers for Older Adults. And in doing the research to put this report together, we spoke to caregivers across all of our communities, and the common denominator here is that they are all caregivers for older people themselves. The original survey had approximately 1,100 respondents, and the survey went out in 8 languages. There were also 36 focus groups in 15 cities, also conducted in 8 languages, and this was all before the pandemic hit. Then when the pandemic hit, it seemed like an important opportunity to see how the pandemic was impacting the caregiving space. And of course, it was impossible to do things, and still is difficult to do things, as you can tell, in person at the moment, given the pandemic, the ongoing pandemic. But we did conduct a number of webinars with caregivers from each of the diverse elders communities. And we even conducted polls during each webinar to get a better sense of the challenges facing the folks in our communities. We also conducted 18 stakeholder interviews and talked to about 300 plus people during the pandemic. And what we learned, perhaps not surprisingly, is that the pandemic made things much worse in terms of caregiving, meaning it created additional challenges for people. So what are some of the challenges that we heard about from our community members, both before and during the pandemic? The very short answer to all this is that people need more support. And what does that look like? We heard about challenges regarding mental and emotional well-being, challenges with respect to social isolation, challenges with related to finances. And in terms of what people were looking for, they really wanted some additional services in terms of emotional support, financial assistance, including financial planning. The other thing that I think Lauren mentioned a little bit earlier are the resiliencies we also learned about. And it's important to really lift that up here. While people are facing a number of challenges, based on a long history and traditions in our communities, they also have a lot of resiliency, and that's something they bring to bear as they engage in family caregiving. So, these are values that are common in our communities. And one example of that is that caregiving for someone that you love or whom you love is an honor. So there's certain values that come into play and empower people as they care for their loved ones. Some of the major findings that we talk about in the report is that while people weren't using as many formal services as we might like, as they are eligible for, they were able to spend more time with their family as a result of that. One of the challenges, though, that the pandemic laid bare is that people in normal times have large commuting times if they're still employed. During the pandemic, they realized they did have some more time to take care of their loved ones because of the lack of commuting going on. We also found that people relied on personal networks, and that's not surprising. So, instead of relying on these formal services that are out there and designed to help people just like this, they instead were relying on their personal networks, friends and family and whatnot. So, in part, it's a good story because we hear about the resiliencies of people and the way they're able to tap into the support networks in their life, which are so important. But at the same time, it's also a story of all these services and supports that we work so hard in DC to make sure are available to folks are not necessarily being made available or being accessed by our diverse communities. So what are we doing about that? As Mike mentioned a little bit earlier on, there are some priorities listed in the Raise Caregiver Act, and that people have been looking into through the US Department of Health and Human Services. And a report recently came out with 5 priority recommendation areas that are in the initial report to Congress. And these are from the Family Caregiving Advisory Council. So what we did in this report is we take those 5 priority recommendation areas as jumping off points, and we in turn list 5 priority areas or those five priority areas and talk about how they can each better meet the needs of people in our communities. So before I wrap up today, I'm going to go through each of those priority areas, but through the lens of the Diverse Elders Coalition and what we hope that HHS and the federal government writ large tackle as they move forward on addressing these caregiving issues. So priority number 1, through the lens of the Diverse Elders Coalition, would be to increase awareness of LGBTQ+ caregivers, tribal caregivers, as well as caregivers from other diverse communities, including targeted education, defining who is eligible for services. Priority area number 2, increased emphasis on integrating caregivers considered quote unquote families of choice, immigrant caregivers, limited English proficient caregivers, caregivers from the same tribe, long distance caregivers into processes and systems from which they have been traditionally excluded. Priority area number 3, increased access to services and supports to assist family caregivers by including and investing into more resources to overcome language and cultural barriers and prioritize funding, translated resources, services, and information. Priority area 4, increased financial and workplace protections, such as paid leave for caregivers, with specific focus on preparing to care for the future finances, and financial education. And last but not least, priority area number 5, better and more consistent research and data collection facilitated through partnerships with CBOs who have established community trust with the aim of increased participation in research studies like caregiving surveys or focus groups. So our goal at this point is to make sure that as the implementation of the RAISE Family Caregiver Act moves forward, that this process takes into account the experiences of diverse caregivers and the people for whom they're caregiving. And the release of this report and this webinar today are an important first step in trying to make sure that that happens. So with that, I'm going to turn the floor back to Lauren.
Thank you, Erin, for covering so much ground around the policy side and for giving us some background on SAGE. I'm now going to turn it over to our co-authors of this report, the team at the National Alliance for Caregiving, Dr. Mosmi Bose, who's assistant professor at Montclair State University and a consultant for the NAC, and Lauren Tokorowicz from the NAC's research team.
Hi, I want to thank everybody for being here today and all of our panelists for being here as well. Mike introduced the National Alliance for Caregiving earlier, so I'll jump right into the NAC side of this research. My name is Lauren Tokarowicz, and I'm the research manager at the National Alliance for Caregiving, and I'm going to introduce our report, Caregiving in a Diverse America, Beginning to Understand the Systemic Challenges Facing Family Caregivers. The report was done in partnership with the Diverse Elders Coalition and the National Minority Quality Forum, and it was made possible with sponsorship by Amgen. Caregiving in a Diverse America used data collected from our Caregiving in the US 2020 report, which was conducted prior to the pandemic in partnership with AARP Public Policy Institute. The report includes nationally representative quantitative data on African American caregivers, Hispanic caregivers, and Asian American and Pacific Islander caregivers, as well as caregivers from the LGBTQ+ community and caregivers stratified by income level and geographical location. To account for possible confounding variables that may unknowingly impact the association between groups and outcomes, we commissioned Dartmouth College to run multiple logistic regression analyses. Their question was, do caregivers identifying with diverse backgrounds, including race/ethnicity, income, and LGBTQ status, experience different outcomes regarding strain, intensity of care index, ADLs/IADLs, and information/services used? Despite the vast demographic representation of family caregivers in the United States and the Caregiving in the US 2020 dataset, there were some scope limitations to understanding diverse family caregivers. The study was cross-sectional, meaning it can't determine causality between predictors and outcomes, and the survey was conducted in English and Spanish only. Two key recommendations we suggest after conducting the research for the report specifically address challenges that became apparent in the crucial effort to understanding diverse communities in the United States using nationally representative data. Future data collection needs to both address the lack of American Indian and Alaska Native representation in research and address the lack of intersectionality and segmentation in research. Many of our findings support those that the DEC have discovered throughout their research. I'll turn it over to my colleague, Dr. Mosmi Bose, to tell you more about them.
Thanks, Lauren. As Lauren mentioned, I'm a consultant for the National Alliance for Caregiving, and I've had the pleasure of working with the NAC for a little while and helping with this report. And I'm just honored to be here and share this platform with these amazing people. Thank you, Chairman Scott. Thank you, Erin, and thank you so much to Mrs. and Mr. Conway for sharing their story. I feel like stories like that really bring this research to life. So I'm going to share a little bit from the NAC report that was just released today. Just a few things that I want to say. We learned so much in gathering this data, in not just some of the disparities as well as the unique experiences of caregivers from diverse communities, but also giving insight, as Lauren just mentioned, into what are the appropriate next steps in better addressing the needs of caregivers from diverse communities. So I'm going to highlight just a few of the findings with respect to specific outcomes. I'm going to start talking a little bit about the impact of caregiving on financial strain. And I'll start by just saying that family caregivers spend over $500 billion per year in costs associated with providing care to their recipients. And when we stratify caregivers by income, the caregivers that are in the lowest income bracket are much more likely to assist with a lot of different caregiving tasks, including shopping, meal preparation, helping their care recipient in and out of the bath and the shower, as well as housework. This, which really translates into an increased burden for caregivers in this lower income bracket. Caregivers are also in the lower income brackets are also more likely to use respite services, use home modifications, and use resources like the internet for caregiving information, perhaps highlighting the need to increase the availability and expanding out some of these services. Moreover, we find that when we stratify by income as well as race and ethnicity, more Black and African American caregivers, as well as Hispanic and Latinx caregivers, are in these lower income brackets, experiencing this increased burden, and also have been shown to have more financial impacts, such as taking on more debt, missing bill payments, and filing for bankruptcy. So that's just a summary of what we observed with looking at outcomes related to financial strain. I will move on and talk a little bit about outcomes related to mental health. And what we observed in our secondary analysis is that the self-reported health of both Hispanic and Latinx caregivers, as well as Asian American and Pacific Islander caregivers, have declined over the last 5 years, since 5 or 6 years, since 2015. And this may be related to Asian American and Pacific Islander caregivers reporting that they feel like they have an higher increased burden of tasks, and also feeling like they have no choice in assuming their caregiver role. Among Hispanic and Latinx caregivers, we find that these caregivers are more often the sole caregiver providing care for their care recipient, and that's associated with lower psychological as well as lower physical well-being, particularly when caring for recipients that are experiencing dementia. When we are looking at our LGBTQ+ caregivers, similar to what we saw in Hispanic and Latinx caregivers, we are finding that LGBTQ caregivers are more often the sole caregiver. Our research also showed that they are more likely to feel alone in their caregiving experience, and this may be due to existing bias and discrimination towards including the LGBTQ community in more traditional familial structures. Another thing I want to mention about these mental health outcomes is that, interestingly enough, some of these groups that we were looking at have actually have reported experiencing less emotional strain. And I wanted to sort of let that kind of segue into the last outcome that I want to talk about, where we talk about some of the positive aspects and protective factors of being part of caregivers in these different diverse communities. So one thing that we found in our secondary analysis is that compared to 2015, Black and African American caregivers have reported having an increased role in shared decision-making for their care recipients, which allows for their voices to be better heard. Like I was saying before, despite this increased burden that is reported by both Hispanic and Latinx caregivers, as well as Black and African American caregivers, these groups are more likely to report less emotional strain, as well as finding more meaning in their caregiving experience. And I think this, this just sort of speaks to, not only is it important to highlight some of the disparities that we see across different diverse groups with respect to caregiving, it's also important to really truly understand what their experience is, because the truth of the matter is there's so much that we can learn from these diverse experiences that can be used to help all caregivers. So I think that just sort of goes back to what Lauren was saying earlier about there's just really a need for more research to truly characterize the experience of diverse caregivers. So I will end there, and I'll pass the mic back.
Thank you all. Thank you, Dr. Bose and Lauren Korowich and Erin, for just giving us kind of that picture, tying together the Conway's powerful story with some of the data, some of the analysis that we have, and then some of the policy implications. I'm going to introduce our last speaker next, Deborah Stone-Walls, who's Chief of Programs and Services at U.S. Aging and also a member of the RAISE Advisory Council. So welcome, Deborah.
Thank you so much, Lauren, and thank you all. Thank you to the Diverse Elders Coalition for the opportunity to spend some time with you today. Wow. Even with a break between the Conway story, their story really does sum up, I think, the passion and the commitment with which the members of the council really, truly did approach this absolute privilege and awesome responsibility to create these recommendations in the report for Congress. The council was is comprised, we're still meeting, and I'll tell you a little bit about that. We're still meeting, and we are comprised of 15 voting members from the community, members from service provider, agency. Most all of us are caregivers as well. And we represent a wide diversity in composition. I identify as lesbian and can certainly relate to some of the things that I've heard today about the group to which I belong. But we've had the opportunity to come together. And one of the, we've heard a lot about the recommendations. We have 5 goals and 26 recommendations that we narrowed down to. But I want to tell you a little bit about the guiding principles. We did all of this work with 5 guiding principles, and they're buried in the report a little bit, but those principles are the family caregiver. The term family caregiver is an inclusive and holistic term that includes all who are caring for individuals across the life course with chronic or other health conditions, disabilities, or functional limitations. The second underlying principle, promoting adoption of person and family-centered care puts the person and the family at the center of care teams, acknowledging the challenges of possible conflicting goals. What does a diverse family do when maybe the healthcare provider has a different set of goals than they do? So it was really important to us to make sure that people, regardless of how they identify, are truly put at the center of their care teams. Number 3, efforts to support family caregivers should advance the autonomy, choice, and ability of the person receiving support to engage meaningfully in their communities and include caregivers to help guide the support and care needed. Number 4, recommendations should recognize and support family caregivers in a fair and impartial manner that accounts for financial impact and respects and appreciates their complexity, diversity, and dignity. And number 5, the National Family Caregiving Strategy will be a living document with ongoing actions created in partnership with family caregivers to be taken by federal, state, and local governments, communities, providers, and others, while fostering cross-discipline and cross-sector collaboration. That's a lot of words, but I get really, truly emotional about this. You know, and I think back to Erin's rewording of the recommendations that this group of 15 voting members and then 15 members from various federal agencies had the privilege to put together. This is a living document, and we're getting to the fun stuff though. I think we're about to embark on the national strategy, and we need your input. It is so important that our work is founded and rooted in the caregiver experience. We know that we have more than 53 million people like Mrs. Conway. There's over 53 million caregivers in America right now, each with an important story. And on the RAISE website, there are videos of a cross section of caregivers. And if you've been inspired today by the Conway story, I would advise you to go to the RAISE Family Caregiver Act or Caregiver Council, sorry, page on the acl.gov website. I know it's been put into the chat a couple of times today. I would encourage you to go and look at those videos. And I will tell you that the work that we embarked on truly was rooted and guided, and we want it to continue to be rooted and guided with diversity in mind, with caregivers at the forefront in that care partnership. I really like that term too, care partnership. I think we saw in the Conways what a partnership they have. And I'll just say as a side note, I really liked the kickin' high, squatting low line, because that really does show the creative solutions and, well, the determination, right, to meet our loved ones where they are and look for those creative solutions while we are so strong and taking care of ourselves and really determined to make life work for ourselves, for our family members. I will tell you that on January 25th, there will be a joint convening, not only of the RAISE Family Caregiver Advisory Council, but of the Grandparents Raising Grandchildren Advisory Council. That was also formed at the same time as the RAISE Advisory Council. So we will be meeting together. We know that this is a time when I don't think I've ever seen a time in my professional career when caregiving was so much at the front. And we are living in an opportune time, a time when really we can make a difference. And we have this awesome responsibility and privilege to create this national strategy together. And I so appreciate your willingness, whoever's here with us today and whoever watches after. I appreciate your willingness to speak up, to speak out, to make a difference in making life better for the diverse group of caregivers we have. I know at US Aging, diversity, equity, and inclusion are really founding principles of the work that we do every day. And I so appreciate it that that is also the Diverse Elders Coalition goal. We have to just keep going, right? Keep pushing and keep speaking up. So again, thank you for the opportunity to be here with you today, and join us on January 25th. We'll be looking to, we will be putting together that national strategy. I know that right now over 50 federal agencies have responded to the call to help us create, I guess it's a needs assessment. We're looking at what services we have in place and where the gaps are, and we all know there's gaps. But we're doing this in a very systematic manner, and we really need your help. So join us on January 25th and help us push this thing forward so that it truly is a living document that is influenced and informed by diversity, equity, and inclusion. Thank you so much.
I'm popping back on here because I'm seeing a note in the chat that Lauren Pongan lost power. So she was going to be the one to introduce Yanira Cruz, who will be doing closing remarks. So I will just go ahead and say, go ahead and take it from here, Yanira, and you can introduce yourself as you would like to be known to the group.
Thank you, Mike. It's, wow, what an amazing panel. How inspiring I am by all the stories and by all the work that has been done. And I have to say, as someone who has been part of the Diverse Elders Coalition from the beginning, a founding member of this coalition, I'm just so, impressed with the progress we have made and how far we have come in the caregiving space. And this speaks really to the power of coming together. I remember when we first met with members of the Diverse Elders Coalition to form the coalition, we were meeting somewhere in New York, I believe. And, the reason we came together was because we shared a common denominator, all of our diverse groups represented here, and that is lack of access. And for different reasons, we were having lack of access, and that's what brought us together at the time. And it's just amazing, and what a pleasure to see how far we have come together collectively, working on making a difference in the caregiving space. So I want to just say that as I reflect on our experience with the Latino specific space and caregiving, I go back to the time I met Sandra. Sandra was a caregiving at the time. We were just starting to sort of recognize this whole problem that we were having in our communities around the challenges facing caregivers. And so Sandra was at the time an English as a second language teacher. She had 2 kids, young kids. Her mom was diagnosed with Alzheimer's, and she was the only daughter. She is the only daughter. And so in keeping with Latino culture, right away, she gave herself to the care of her mom. She quit her job as a teacher. She took the role of a caregiver, and so there's a few sort of items that I like to extract from there that sort of speak to the Latino specific side of caregiving. And that is that the implications with regards to the economics that are impacted for the family when a caregiver dedicates herself or himself to this activity. And those are real issues that have already been alluded to. But I think culture and language are very important for Latinos. And familism, as you probably have heard this term before, involves, dedication, commitment, and loyalty to family, which in the case of Sandra's story, she quit her job and dedicated herself to caring for her mom. And oftentimes with Latino families, the women are the ones who are expected to kind of play that role. And so the impact that Latinas are having with regards to caregiving is a serious matter that we need to continue to pay attention to. And of course, we can't speak of Latino caregiving without recognizing and acknowledge health disparities. The fact that some of the key issues impacting health disparities are lack of resources and lack of culturally and linguistically appropriate resources that can help the caregiver with supporting in the role of a caregiver. The fact that Latinos are being disproportionately impacted by Alzheimer's and other dementias. I think those are important issues to keep in mind. Now, the good news is that we have this report, and this is a fantastic resource that we have for the first time. And our hope is that that the recommendations from this report, the work that has been unveiled, will inform the national caregiving strategies moving forward. And of course, I want to just take a moment to acknowledge and thank some key individuals that have helped us get to this point, have helped us make progress on this work. First of all, our fellow Diverse Elders Coalition member organizations, we want to thank them for their contributions to the research and for hosting webinars and for supporting caregivers from our communities. We also want to say thank you to the National Alliance for Caregiving for their partnership in authoring this report. And the Benjamin Rose Institute on Aging for their partnership in research on diverse family caregivers for older adults. We also want to say, express our gratitude to our fellow speakers today, especially Chairman Scott for his remarks. We also want to say thank you to John A. Hartford Foundation for believing in us and for supporting this work on caregiving. And a heartfelt thank you to the caregivers who share their personal stories and time to inform this work. And finally, I also want to say thank you to Lauren and her team for their leadership, for leading this effort and getting us to this point. So thank you. And with that, I turn it over to Lauren, if she is back, if she's connected.
Thanks, Yanira. I'll take it back on behalf of Lauren, who of course her power couldn't wait another 10 minutes or so to go out. I'm sure she had some great remarks lined up in closing, and I wouldn't want to try and compete with that. So I will just say, thank you all for being here today. Thank you for listening to the stories, to listening to the research and the policy recommendations. We're just starting this conversation, and we want to be able to have more conversation with all of you on this call who would be interested. So we will be following up with contact information for members of the DEC team, DEC member organizations, National Alliance for Caregiving team, and we'd be happy to do any follow-up conversation as you see fit. And we will also make sure that all of the materials that we referred to today, that report and the one pager and all that stuff, go out with links for everybody as well. So thank you all for being here again, and take care, and we'll talk to you soon. Thanks.